How how many are you in this class?
Uh,
How many students are you in this class? Okay, who is the president?
Class?
Please. Class president.
Hello, Doc. Sorry.
Hello, who is the are you the president?
Yes, Doc.
Kita kan ika si
Kier, Doc. Kier Antoliho.
okay. Sige. So we are expecting so many students to join us.
Today, Doc, kay around 99, Doc.
99. Okay, so we are at 88. So I expect more to come in.
But others are having internet connection problems, ba, Doc.
Okay. So can everyone hear me? Okay na? So that we'll start. So I don't think there are more people coming in. So we are at about 91 participants. So welcome to okay. Welcome to the new normal. So you can see my face because I'm in my clinic and I have to wear a mask because I had patients come in a few hours ago. So I'm not really sure if there's still viral particles floating in the air. So I have to wear a mask. Anyway, so my name is Dr. Uh, Japhet Agunias. I'm a neurologist and I'm the department chair of neurology. So I'm going to admit more people. Okay, so we have 93 participants. So I'm going to share my screen now. All right. So can you see here? Can you see the slides?
Yes, Doc.
So we're going to play. Hmm. Okay. So welcome to the introduction to neurology. So this is about the diagnosis and treatment of different neurological conditions. So I'm sure I'm 100% sure that when you go to the clinics, you will encounter many of these patients. And I think when you were in second year, you had your physical diagnosis, right? Here, you had your physical diagnosis, no?
Yes, Doc.
Okay. But you did not have the neurologic examination, right?
Um,
Wala.
we had basic, Doc. Katurang, kuan, Doc. Physical o, yeah, history taking. Mga
History
basic.
basic. Okay. So how basic it is, I'm not really sure because I'm not briefed by the other faculty members on what you had what you had last year. So, but largely the first part of our module will be on neurologic, history taking, and physical examination. Okay, so supposedly we have five lecturers for the neurology class, but unfortunately, I don't think the other mentors are available because of their busy schedules. Because we for this year, I really have to redo everything. I have to simplify the lectures because normally last year we were given 2 sessions per week and 2 hour sessions per week. But I saw the schedule, and the neurology module was compressed into just a few days. But we'll try our best. I'm going to give you a shortened lecture, but nevertheless, we will be focusing on the essentials of the different neurological conditions. So, but still, your examinations will still be taken out from Harrison's, and it is expected that you should be correlate everything. So the way I ask questions on during examinations is like the USMLE style question of you'll be given a case, and then you'll be expected to come up with a diagnosis, and then there will be questions related to that diagnosis. So it's a two-step approach. So I will most of my questions are like that in your examination. So you should be able to read the chapters and not just listen to my lecture. So what I'm lecturing will just be the must knows, the essentials, but there will be some questions about details that you really have to read the book. Okay. So the prerequisites for this subject is that you should have a basic knowledge on neuroanatomy. So you had neuroanatomy when you were first years. So it's expected that you should be able to recall some of that knowledge that you have gained uh, from your first year. Um, wait, there's some people wanting to come in, but okay. I have to admit all of them. Um, with uh, my mouse. Okay. Um, Kier, will you be able to accept those in the waiting room? Naba kay kuan, ano?
No, Doc. Kay ikaw man ang host, so dili ko ka
Yeah,
touch. Ano.
yeah. The problem is that I can't. Uh,
But it's recorded man sa Doc, so
so it's recorded. Okay. So
oo.
you can view the orientation at a later time, right?
Yeah, yes, Doc. It will be posted man sa Blogspot.
Okay. So yeah. And so you're so going back, you have to have a basic knowledge of neuroanatomy. So in particular, so the structures of the brain, spinal cord, and the peripheral nerves, and of course the different pathways and the functions of those pathways and other systems. So the cortical spinal tract, the spinal thalamic tract, all of those tracts. So you should be able to review it. for you to appreciate neurology in general. So, neurology is a very logical discipline that emphasizes the localizing the lesion. So, based on history, physical examination, and determining the most likely diagnosis. Okay, so it's basically an exercise on good history taking, focused history taking, and complete physical examination with emphasis on neurologic examination. So, at about 90% of the time, you should be able to get the diagnosis even before the results of your CT scan and your neuroimaging and other laboratory examinations. So, next, you should also be able to have a basic knowledge on physiology, your action potentials. So if you remember that, that's very important in the study of peripheral neurology in diseases um, affecting the peripheral nervous system and even in the central nervous system. So you should have a some knowledge on physiology. Okay, so this is very but very microscopic in the sense that we talked a lot about action potentials and membrane potentials and synapses. Okay, so you should be able to have also knowledge on the pharmacology of the medications that are being prescribed in various neurologic conditions. So I think you had pharmacology, right? Na complete ba ninyo ang Goodman and Gilman? Did you touch on neurologic diseases like anti-seizure meds, mga ana? Yes,
Yes,
yeah, okay.
of course, by
All right. So you should be able to come to a treatment decision after you diagnose the patient. Okay. So for reading materials, two are required. So one is Harrison's Internal Medicine. So all the neurology chapters, you should be able to read this. Um, Next would be De Meyer's Technique of the Neurological Examination. So if you don't have the book, you can borrow it in the library. But I think some of you are very resourceful that you should be able to get a PDF of this online. Okay, so my physical examination lectures will be based on D. Meyer. Okay, and the videos that I will be playing to you were also based on D. Meyer. Okay, so question: no foreigners in this class. You should be able to understand Tagalog at least.
yes, Doc.
Okay, so because the physical examination videos were recorded in Tagalog.
Doc,
Yeah,
Doc, I cannot understand Tagalog.
sorry.
I cannot understand Tagalog.
Who is this?
Gerald.
Gerald. Okay. Sorry about that. But okay, I'll try to find videos for you. But largely, the narration is in English, but the way they ask the questions, the way they ask the patient to perform certain maneuvers will be in Tagalog, but the descriptions are all in English. Okay? And if you want further learning, here are some books that it's optional. Here are some books that if you want to read them, you can read this. So the Bible in neurology is actually Adams and Victor's Principles of Neurology. So no self-respecting neurology resident um, could skip this. Okay, so this is our Bible. This is where we get. This is the final arbiter of information when we were in training. So next would be Differential Diagnosis by John Patton. This is a very rare book. So if you can get your hands on this book, then that's Very good of you. And this one also localization in neurology and Massachusetts General Hospital Handbook of Neurology, the Washington Manual of Neurology. So these are books when you go to your clinics and you need to find a quick reference on how to manage neurologic conditions. Okay, so this is our tentative schedule. So this is subject to change. Let me correct that. The schedules, okay, the days that we will be meeting is um, is fixed already, but the subjects uh, tackled on that particular day will change. So we have a session next week. So this is a 2 hour session, I guess, and so some of these topics will not be discussed because the videos will take at least 2 hours. But here are on the right side, you can see that some days are just being labeled neurology. So I will just rearrange the topics as I see fit. Right now, I have no um, fixed schedule for lectures yet because I'm very busy. But expect that at least 2 to 3 days before Monday or maybe on a Saturday, I will email or post the case, the takeoff case, and the learning objectives and things to read. Okay, and what topics will be discussed that week. Okay, so for next week, we will be discussing on neurological history and physical examination, and on August 17th. So I think this will be cerebrovascular disease, multiple sclerosis instead, and neuroimaging. Anyway, I will just update you. So yeah, but for next week, I will be giving you your first case. So this is a 67-year-old male. So who came to the ER for slurring of speech and right-sided weakness. So this is a very common scenario. One of the most common reasons for hospitalization is one of the most common diagnosis in the emergency room is stroke. Okay, so this is pretty obvious. So okay, sudden onset, slurring of speech, right-sided weakness. But when you're confronted with these patients, how do you approach them? Okay, so next week's lesson will be focusing on asking the right questions, meaning you should be able to um, ask the right questions regarding risk factors and other pertinent information. Okay, so and also a more detailed case. So this one is just a phrase, slurring of speech and right-sided weakness. So you should be able to ask when did it start, for how long, okay, where, what was the patient doing. So other those details you should be able to ask. And also, how do you do your physical examination? And when you get your pertinent information and physical examination findings, how do you arrive at a diagnosis? Okay, and what are your other diagnoses? So this is not just stroke. So other neurological conditions may present with slurring of speech and right-sided weakness. Okay, so I think that's it. Yeah. So sorry. Anyway, do you have any questions? Okay, Mr. President, do you have questions?
Tentative po man ang schedule, no? Kay
Yeah, but but
ganit
for but for Monday next week, the 2 hour session, the 1:30 to 3:30 p.m., will be dedicated on neurological history taking and physical examination.
okay
Okay,
po.
okay. So, and on August 17 will be dedicated to um, neuroimaging and what else? Cerebrovascular disease, multiple sclerosis, and other demyelinating diseases. Okay, and the rest, because those are one of the more important subjects in neurology, so I think it is fitting that this should be discussed first. Okay,
Um, my question about grading, doc.
grading.
Grading system.
Um, I don't know about that. Yeah, but largely based on examinations.
Okay, doc. Then, but you mentioned sa first case, doc. Do we need a written output for it, or
No, no written output, but possibly at the end of the semester, depending, it would depend on how things would go in terms of the pandemic. But I might want to have a return demo on physical neurologic physical examination and history taking. So let's see
okay?
how things go because there are there are more than 100 of you. So I'm not sure if the other doctors should be willing to participate in the return demo or OSCE. Okay, because we did that for the previous years. Any more questions? Wala na?
Hello, Doc. Good afternoon.
Yeah, afternoon.
Um, about sa Harrison Sambo, unsa nga edition gamiton for this year? The latest ba?
Yeah, what's the latest edition?
20th, Doc.
20th. Okay. So let me check what edition I have. Hmm, it's- hmm, hmm. Something's not right about my mouse pad. Um, wait. But anyway, so we will be basing the questions on the latest edition of Harrison's. Okay. So unsa to nga year ang latest edition? It,
I think Doc 2019.
2019. So I will be asking questions that are um, not really controversial. So you can find the answers to any Harrison's maybe for the last two or three editions. So I'll be asking required knowledge and also um, those facts that have been known for quite some time now. Okay, so nothing really groundbreaking. No, I won't ask those questions. Okay, so are we done? Are we done now, Mr. President?
Yes, doc. If there are any questions, doc, how can I reach you, doc, if ever?
Yeah, I think I have your number. So I'm not really sure. Share here. Hmm. Okay. So, or Jamie man to ang or Jaime ang nakabutang diri.
Yeah, maut na ang sa last, Doc. But I think Doc Santos will give you my number, Doc.
Let me check right now. Okay. So this is 0917703845, right?
Yes, Doc.
Okay. I'll say okay. So I have your number. So I'll just text you. Okay.
Okay, Doc.
All right. Okay. So we're done now. Okay. Bye.
Thank you,
Bye,
Doc.
Doc.
Thank you.
Thank you, Doc.
Thank you,
Thank you,
Doc.
Doc.
Thank you, Doc.
Doc.
Thank you, Doc.
Okay.
Thank you, Doc.